So welcome back. I made a little bit of a change on at the end of the last video, and I ended up choosing for us to separate the lung disorders as a whole separate video. So let's wrap up our recordings by looking at some of those. And I want to start by talking about asthma. So in asthma, we have chronically inflamed, hypersensitive bronchial passages, and this is really in response to irritants, and those responses could be dyspnea, coughing, or even wheezing. And this picture that you see on the screen on the left-hand side really nicely captures what happens in an asthma attack, where the respiratory pathways end up constricting and the effect of that. A lot of asthmatic people rely on asthma pipes, so we use two types of medication, one for maintenance and one for asthma attack for dealing with that. So that was our first respiratory system disorder that I wanted to mention. Let's have a look at the next one, COPD. COPD stands for chronic obstructive pulmonary disease, and this is exemplified by two conditions that we'll talk about, by chronic bronchitis and our emphysema. The shared features between these two, so bronchitis and emphysema, are really, I think, four main ones that I can think of. Both conditions involve patients almost always having a history of smoking. So this is why smoking is so bad for us when we try to encourage you not to do that. And we see on both labored breathing, so dyspnea, that becomes progressively worse. We see as a third characteristic that coughing and frequent pulmonary infections are very common between the both. And finally, we see that most COPD patients are hypoxic, so they retain carbon dioxide and have respiratory acidosis and ultimately develop respiratory failure. So let's look at both bronchitis and emphysema a little bit in more detail, starting with the chronic bronchitis. Here, mucosa of the lower respiratory passages becomes severely inflamed. We see excessive mucus production that impairs the ventilation and gas exchange. Now, patients become cyanotic and are sometimes called blue bloaters as a result of chronic hypoxia and carbon dioxide retention. And then let's have a look at the emphysema. Emphysema, here we see that alveoli walls are destroyed, the remaining alveoli enlarged. And chronic inflammation promotes lung fibrosis and lungs lose elasticity. Patients use large amounts of energy to exhale, so some air still remains in the lungs even after that, and these sufferers of emphysema are often called pink puffers because of the oxygen exchange is efficient. The overinflation of the lungs leads to permanently expanded barrel chest, which is a very typical characteristic, and cyanosis appears late in the disease. And the final clinical condition relating to respiratory system that I wanted to finish off with is talking a little bit about lung cancer. Lung cancer is the leading cause of cancer death for both men and women. Nearly 90% of these cases result from smoking. And this is an aggressive cancer that metastasizes rapidly, and there's really three common types. There's adenocarcinoma, squamous cell carcinoma, and small cell carcinoma. And I've shown there on the screen an X-ray of lungs where we see lung cancer. You can see it really showing up nicely. And really, as a reminder, once again, remember, this is why smoking is something that we so much would like to steer you away. Smoking is an addiction, but it is something that we can definitely beat. We do want to make sure that the lungs are protected as much as possible, and smoking is one of the worst things you can do for yourself on that front. So if you're a smoker, please consider stopping the smoking. There's great help available, so I think that that's definitely worthwhile to investigate. So that brings us to the very end of all of the lecture material that I wanted to cover in today's or this chapter's materials. Like I said, in a lab, you'll also get to measure your own lung volumes and calculate your own lung capacities with the spirometry activity. At this point, that's it from me on these recordings. I look forward to continuing working with you, whether it is in a classroom or an online environment. Until next time that we see, thank you and bye.